Hey guys, this is Dr. Kyle with Columbia River Chiropractic, bringing you your next tip for Tuesday. What I wanted to use this tip for today is to talk about two particular things. One, just kind of a reiteration of what chiropractors do and why they do it. But I also want to connect it to a common reflex that all of us have built into us, but nobody really hears much about, and kind of how that plays into our spinal health in general. So one thing to remember with chiropractors, we are specialists in what's known as segmental motion of the spine. We're kind of the only profession that really focuses on this in regards to general health and wellness. What I mean by segmental motion of the spine is basically how one bone moves relative to the bone next to it in your spine, and how this can kind of have a domino effect up and down the spine relative to that motion or lack of motion. Another important thing to understand in regards to that motion of the spine is the alignment and symmetry of the spine because of these little guys. These are our nerves. They're called our peripheral nerves, where they branch off our spinal cord, and you can see from this angle that they come out of a little hole right here. So if I kind of change the motion or the position of some of these bones relative to the other, you might see how that could potentially compromise that nerve. Sometimes people might feel pain, but you might not feel pain at all, and you might just have a diminished function to certain body parts that nerve may innervate. So again, that's kind of an important thing to understand. Now, one of the things that chiropractors focus in regards to this segmental motion is the balance of your spine. So not only just looking at your spine kind of straight up and down as far as a balance from right to left, but when we look at the side of our spine, you can see, like in this model, we have a couple of little natural curves that we develop over the course of time. One in our neck is called a lordotic curve. It's kind of a reverse C here. Then we have what's called a kyphotic curve. That's in our mid-back. That's a C curve. And then you have another lordotic curve in that low back. And then you have a mild kyphotic curve down here in what's called your sacrum bone. Ultimately, what this means for you guys is the health of these curves will directly relate to the health of your spine, because it essentially creates a spring effect. So it helps us kind of dissipate stress throughout our spine. And very commonly, like we'll see here in our clinic, when people will get x-rays and they have a loss of, say, like their neck curvature in their spine, they usually have not only an increased amount of degenerative disc disease or degenerative joint disease, arthritis, those kind of things, but they also tend to have a lot more going on around the neck as far as pain symptoms are concerned. So again, that kind of relates back to what is important in regards to our spinal health. Now, the second part, like I had mentioned, I want to talk about a reflex. So there's actually something that we have programmed in our bodies from day one called a righting reflex. And basically what this means is that our eyes are programmed to be at a horizontal. They're programmed to look kind of directly straight ahead. And so if our head or neck starts to wander, say like if you're at a computer desk and you're slightly angled this way for the entirety of the day, your eyes will naturally want to come back to more of a midline. And that's just that's kind of to our advantage, but it can also be to our detriment if we've had an injury. So think back to when you were a kid, how many times you would have fallen out of maybe your bunk beds or a tree and landed on your head, squished your neck. Think the good majority of times your body will probably bounce back and recover. But sometimes, if it doesn't, if your neck, you kind of crushed your head on top of your neck and you stay kinked like this, even if it's very subtle, that reflex is still the same. So your body, your eyes are still going to want to come back to this midline. So if you kind of kink your neck to one side, your body's not going to like that. And ultimately, it's going to adapt and compensate further down in the spine to make up for where it is unable to move. So what that basically equates to is I'm going to bend maybe in my lower neck or my mid-back or my low back to try and balance out that alignment of my eyes. And ultimately why this is important is because these kind of injuries that we might not pay much mind to, say, the accidents when we were a kid, or if you sit at a computer desk all day long, or even if you've been in like a motor vehicle accident, these kind of traumas to your neck can certainly relate to an issue you might have in your low back, as far as maybe an issue in your hip, or you have a mechanical low back pain, or sciatica, those kind of things. Again, can all relate back to some dysfunction of the neck because of this righting reflex. So I know this is a little bit wordy of a tip for Tuesday, you guys, but I think it's really important to understand within the context of chiropractic why a little thing like a neck injury is so important to understanding the health of your entire spine and how it relates to your health in general. So like I said, hopefully this makes sense. If you have any more questions, please don't hesitate to contact us. My name is Dr. Kyle with Columbia Chiropractic. Thanks for watching.